Hey guys, Dr. Putney here from Wellington Family Chiropractic, and today I want to talk about a common condition we see in the office and we treat every day, and that's low back pain caused by pregnancy or throughout somebody's pregnancy, they start to experience low back pain. So this is very common in our expecting mothers and those patients, and it's very common across the board. If you look at low back pain during pregnancy, they estimate 50 to 70% of women expecting a child will experience low back pain at some point during the pregnancy, so this is very common. It's not a huge deal when it pops up, but it can be scary for the patient, and they're worried about it getting worse because, again, the baby is getting bigger and bigger as pregnancy goes along. And this usually comes on because of some of the changes that are happening within the body. The obvious one is you're growing a baby in your stomach, and as that is happening, the stomach's expanding, the pelvis is getting more pressure, the muscles and the ligaments are under more tension, but your hormones are also changing, and there's some hormones that cause the ligaments around the pelvis and throughout the body to relax in order for that expansion to occur. And the combination of these things can really cause some, stubborn low back pain all throughout pregnancy. So today, I want to let you know, yes, you can get adjusted during pregnancy. It actually does very well for our patients. It's extremely safe. And then I want to give you a set of exercises I've found help most of my expecting patients. So what I'm going to do first is have Jay here get in what we call a quadruped position. And one thing I like to teach during pregnancy for my patients is they are not going to be able to, especially they already have kids, they can't just quit doing all the things they normally do. They're still going to be caring for their other children, cleaning around the house, maybe they're at work and they have to lift or sit or move through different ranges of motion throughout the day. So it's very important to be able to, if you're experiencing low back pain, guard your low back during those transitions of movements or picking something up, whether it's a kid or something that you have to do at work. So one thing we go over is what's called a abdominal brace. And so what I'll do for my patients is I'll take my hands and just squeeze kind of in the flank area below the kidneys and then around the front just below Jay's last rib, and I'll push in there in all four directions. And then what I have my patients do is take a big breath through their nose, feel that area expand. So if you're breathing properly, we should feel that area go out, not just in the front but through the back, all four directions. So they need to be able to feel that. And then what I'll have them do is just push their muscles into these 4 points and kind of brace as if they're bearing down on the toilet or trying to create pressure or tension in these muscles. And that's what we call abdominal bracing. That's really helpful if you have low back pain during pregnancy, is you can do a little bit of that brace, get nice and tight throughout all 4 spots here, and then go through that movement, which can help you avoid flaring up your low back. So once we understand what that feels like, we're going to keep some of that brace, so it doesn't have to be 100% brace. It can just be, 50% of that or less, but it's enough of a brace to where he's tight here, and that's about right for Jay. The first exercise I want to go through is called a bird dog. You've seen me go through this before, but what he's going to do, he's going to keep his back flat. I always tell patients to pretend they have a glass of water on their back, and they're trying to not let that glass turn or flip over and spill the water. And what he's going to do is slowly raise one arm and raise the opposite leg, again keeping that glass from tipping one direction or another. And he'd come back, and then he would alternate. So he would do opposite arm, opposite leg. So again, he's doing a good job of keeping this area braced and still as the extremities are moving. This is a very good exercise to stabilize your low back and help you from having that low back pain. So we talked about the glass of water. Essentially what we don't want to see is as Jay raises an arm, moves a leg, that pelvis tipping forward too much. This is excessive motion for this exercise. We want to keep that still. We don't want to see that glass tip sideways, so as he goes forward, a big hip turn. Also not the way to do this exercise here. This stays flat, and then we do the exercise as you hold that. And I typically tell patients, you're better off doing this exercise slowly than quickly, because if you rush through it, you're kind of getting through some of these sticky spots where you may not be able to stabilize. You're rushing through it. And again, we're trying to train the low back and the trunk to be stable as we move our limbs. The next exercise is called a cat-cow. This is going to be the same position. You don't need as much of a brace, maybe a tiny bit. He's going to dip his belly towards the table softly until that range of motion stops. And then he's going to bring his back up towards the ceiling. Good. As long or as well as your belly allows you in your different levels of pregnancy, up and down. So this should just move those joints into extension and flexion, and it helps keep your low back from getting tight or locked up. You want to make sure this you're not getting like sharp pinching pains, or this exercise is not making those joints more sore. Usually, like I said, because you're not weight bearing, you're not under a lot of pressure, this is a safe way to get those joints moving. The last exercise is we're going to move down and focus on the glutes. Like I said before, pregnancy is changing the way your body is shaped in a way in terms of your pelvis is wanting to tip forward, the pelvis expands a little bit, there's a lot of pressure out into the glutes, and later in the pregnancy as that happens, we'll start to see some of that pain move further down into the glute or even turn into sciatica. So one exercise we really like to just stabilize this area is called a clam. Again, this is a very common exercise, but it's really good from a pregnant patients. So what he's going to do is relax on his side, and then he's going to bend his knees to 90 degrees and bring one knee up and then right back down. And so we usually put the ankles about in line with the hip, and then he's just moving that as far up as he can. The key here to doing this exercise well is just go up as far as you can without rocking your pelvis backwards. So I'll have Jay do it poorly. So his whole belly's rolling this way. That's not the point of the exercise. We're trying to isolate the glutes. This stays still and he just goes up as far as he can. Now with the bird dogs, the clams, and the cat-cows, what you can do is about one time a day, you can do 3 sets of 10 of each exercise. And like I said before, that can really help just stabilize and take some pressure off your low back through those second and third trimesters where we see the low back pain tend to increase in our patient. Again, it's very common, it's very treatable, it does very well with what we do in the office. It's nothing to be scared about, but it is something to be managed to make sure it doesn't get worse as the pregnancy goes along. Obviously, when you're pregnant, you got enough going on. You don't need to worry about low back pain. So give these a shot. If this has ever bothered you or you're a pregnant patient, I hope it helps, and I'll talk to you soon.